The 5 scariest diseases you could get. In today's video, we are delving into the frightening world of diseases. While it's easy to overlook such things when we're healthy, being aware of terrifying diseases can increase our appreciation for well-being and medicine. Here's our countdown of the 5 scariest diseases you could get. 5. Necrotizing fasciitis. Kicking off our list is necrotizing fasciitis, also known as the flesh-eating disease. This is a rare bacterial infection that spreads rapidly, destroying the body's soft tissue. What makes it particularly terrifying is how quickly it can cause severe illness or death if not treated promptly. Often starting with a small cut or injury, the rapid progression means patients can go from minor discomfort to severe, life-threatening complications in just a matter of days. The fact that this disease can be lurking, undetected, giving little warning until significant damage has been done, is precisely what makes it so terrifying. Aggressive surgical intervention to remove dead tissue and powerful antibiotics are essential to combat this aggressive invader. 4. Creutzfeldt-Jakob disease, CJD. Next on our list is Creutzfeldt-Jakob disease, a rare and fatal degenerative brain disorder. What sets it apart is its rapid progression and the mystery surrounding its origins, sometimes even appearing sporadically without any identifiable cause. Sufferers experience rapid mental deterioration, memory loss, and ultimately death. The scariest part of CJD is its relentless advance. Currently, there is no cure or effective treatment. With most patients succumbing within a year, the helplessness faced by sufferers and their families is chilling. Unlike many diseases, CJD doesn't spare the young and often hits hardest during what should be the prime years of life. 3. Ebola virus disease. Ebola, a name that strikes fear due to its high mortality rate, sits firmly in the middle of our list. This severe viral hemorrhagic fever can lead to death in a relatively short time. The disease is characterized by the rapid onset of high fever, bleeding, and multi-organ failure. Its outbreaks, like the one that occurred in West Africa from 2014-2016, showed how quickly it can spread and overwhelm healthcare systems. The fear of Ebola stems not just from its symptoms, but from the contagious nature of the disease and the devastating impact it can have on communities. While there are investigational treatments and vaccines available, the unpredictability and severity of outbreaks still invoke terror. If you like this video, hit the like button, subscribe, and highlight that bell icon. This will really help this channel out. 2. Rabies. Taking a higher spot is rabies, primarily due to its almost universal fatality once symptoms appear. Transmitted through the saliva of infected animals, rabies induces terrifying neurological symptoms such as hallucinations, paralysis, and hydrophobia. What makes rabies particularly chilling is the apparent ticking time bomb aspect. After a bite, it can lie dormant for weeks to a year, with its symptoms surfacing inevitably only when it's too late for treatment. The stark reality is that without a post-exposure prophylaxis administration soon after being bitten, rabies is virtually untreatable once clinical symptoms manifest. 1. Cancer. Topping our list is cancer, a term that encompasses over 100 different diseases, each with its challenges and treatments. Cancer is terrifying not only for its destructive capacity and ubiquity, but for its ability to hide within the body unnoticed until it's sometimes too late. The randomness with which it can strike across different ages, lifestyles, and genetics adds to its fear factor. Cancer often requires a grueling regimen of surgery, chemotherapy, and radiation, which can be as debilitating as the disease itself. Its psychological impact on patients and their loved ones is profound, driving home the fear of the unknown and the inevitable. While advancements in research and treatment have improved prognosis for many, the shadow of cancer as a global health terror remains omnipresent. Confronting the reality of these diseases underlines the importance of medical advancement and public health measures. Staying informed and advocating for preventative practices allows us to mitigate the risks these diseases impose. For more content exploring the intricacies of health and medicine, don't forget to subscribe to our channel and hit that notification bell. Let us guide you through history, science, and everything in between.